हेलो दोस्तों, आज हम बात करने जा रहे हैं रीनल सेल कार्सिनोमा के ऊपर। सो रीनल सेल कार्सिनोमा हैज़ रिस्क फैक्टर्स विच आर hypertension, obesity, smoking. There is a genetically inherited disease which is a risk factor for renal cell carcinoma, which is von Hippel-Lindau, in which the most common type is clear cell carcinoma. Now coming to the types of renal cell carcinoma, these are clear cell, which is the most common type. Then we have papillary carcinoma, chromophobe carcinoma, collecting duct carcinoma, and renal medullary carcinoma. Now coming to the presentation of renal cell carcinoma, they present as abdominal mass, abdominal pain, and macroscopic hematuria. These three occurs as a triad. Now next we have the paraneoplastic syndrome. It causes erythrocytosis by increasing erythropoietin. Then it causes secondary varicocele. Generally varicoceles are seen between the age 20 to 30 years, but in renal cell carcinoma it is seen beyond 50 years. It also causes rise in the levels of calcium in the blood, which leads to pathological fractures. And the most common site of metastasis of renal cell carcinoma is the lung, where it shows cannonball metastasis. On X-ray, the cannonball metastasis looks like this. Next, we now move on to the staging of renal cell carcinoma. So here we have the stage 1, which is confined only to the kidney. The stage 2 is involvement of perinephric fat, but it is limited to Gerota's fascia. Now stage 3, it is divided into 3A, 3B, 3C. In 3A, there is only the renal vein involvement. In 3B, there is also nodal involvement. In 3C, both renal vein and nodal involvement are seen. Stage 4, there is 4A and 4B. In 4A, direct invasion of adjacent structures are seen. In 4B, distant metastasis is seen. Now, coming to the treatment of renal cell carcinoma, we have nephron sparing surgery. It is used for small size tumors. Then next we have the radical nephrectomy, and then we have the management of metastasis. Here both the modalities are used, which is immunotherapy and targeted therapy. One such example of targeted therapy which is used for clear cell renal cell carcinoma is tyrosine kinase inhibitors, which is sunitinib. Thank you for listening.